The federal government has approved the extension of retirement age from 60 to 65 for clinically skilled health workers, emphasizing the critical need to enhance the delivery of quality healthcare services to Nigerians and improve the capacity to continue to train others. The extension was revealed by the Coordinating Minister for Health and Social Welfare, Professor Muhammad Ali Pate, during a meeting with key stakeholders in the medical and allied fields. Professor Pate stated that President Bola Ahmed Tinubu gave consent to exempt clinically skilled health workers from the extant retirement age of 60 to 65 with an explicit mandate to follow due process for its actualization. This will be our focus on Nigeria today. Thanks for joining us. I'm Victoria Clinton. With me in the studio is Comrade David Chukwuka Ezugu. He's the Deputy General Secretary and Head of Department, Research and Statistics, National Association of Nigerian Nurses and Midwives. It's a pleasure to have you on Nigeria today.
Thank you, madam.
And also joining us via Zoom is Dr. Tokpe Zenith Oshundara. He's the President, Nigerian Association of Resident Doctors. You're welcome to Nigeria today.
Thank you. It's a pleasure to be here.
Now, Dr. Tokpe, I will start with you. What does this extension mean to you?
All right. It's a good one, considering the fact that we have a situation in Nigeria where the doctor-to-patient ratio is suboptimal as against the standard laid down by WHO. So we retaining doctors who are elderly will go a long way to create that atmosphere where we are going to have specialized care. And if you look at the statistics, we have about 6,000 consultants across Nigeria. Of these 6,000 consultants, we have about 1,007 of them nearing retirement age, and about 1,003 already off the shores of Nigeria. So if you do the subtraction, you discover that the number of consultants that we have is actually very small compared to the population of Nigerians, or the population we have in Nigeria. So the government increasing the retirement age to span up to 65 is a good one for us, so that we can still have some of these good hands to give us specialized care, especially when it comes to, or when it has to do with subspecialty in medicine. And there are several people who are going to be needing, specialists in various fields of medicine to attend to their health care or their health challenges.
Very much. Now, Comrade David, the extension, they say, is for clinically skilled health workers. What category of health workers are we talking about here?
Well, when you talk about clinically skilled, you know that practicing health care is not just that somebody comes to the hospital, you give him drugs. There is a level of exposure that a nurse or a midwife who have stayed in those clinical areas, practice nursing over a period of time, have much developed skills, including training of younger ones. So when you want to get these people back into the system, you are trying to ensure that the system does not have gaps in the productive capacity of the ones that will be trained and those that will handle specialized case nursing care in the hospital, and not only in nursing, in other fields of care in our health facilities. Because as one, there's another that he who starts cooking knows how to cook best. And people, if you look at our statistics in the hospitals today, you find out that younger ones are going abroad. Those who have stayed within this age bracket between 55, 60 are many more because we are not recruiting. Rather, people are going. Even federal government tried once to say, when one go, re-engage. But people will go and they leave entirely. And those who have the chance and capacity to carry out these services, it is better that you retain them as a staff than giving them contracts. So the benefit to the health system is unquantifiable. Because
now, before we go to the benefit, we're talking, I really want to know, when you see health workers, the pharmacist is a part of the health worker, nurses, doctors. Apart from these ones I've mentioned, are there other people that are inclusive in these, extension?
The operative word there is clinical health professionals.
Okay, which includes who and who?
Which we have medical lab scientists, we have physiotherapists. They are in clinical practice. There are those who are instructors in schools where this manpower, let me use the word, are produced. Because if a medical student has to go to the medical college, he needs the consultants who will teach him or her. Likewise in nursing, likewise in pharmacy, likewise in medical lab. So these people need to be retained. That's what that policy is about to address. Because if these people are leaving, consultants are leaving, senior nurses are leaving, then how do we impact the younger ones? And if those who have that capacity to train them have left the system, then we are going to run into a very serious problem. I think that is, this issue of extension has been going forth and back for a long time now. And government, in attempts to shift away from it, tried restricting people from going out, which negates the right of people to, negates migration. Any person who wants to go anywhere should be allowed to go. And if we continue to allow people to live at 60 years of service, because the number of years of training, and you check the number of years the person has practiced, and then they retire, you see that the system is suffering by putting resources in the training of these people when they are there to give maximum service. It is the time they will leave. So the extension will benefit both the training of younger ones and retention of the expertise of those who are already at that age bracket of going.
Okay, how much of impact will these policy have on the health sector? Now you are talking about the workers now, the health workers. What about the patients? How much of this will impact?
Yes, the impact to the patients is equally high. Because let me give you, for example, if a nurse midwife of 3 years, 5 years experience is handling a case, and a nurse midwife of 30 years experience, they could not be the same thing. You can't measure them. And the woman who has come for delivery, if you place two of them, she will choose the one that is advanced. The person will have more clinical understanding of the situation, even without, by just looking at the person coming, we have more clinical understanding of the situation of things. Likewise, other professionals. If you bring, let me use this place we are. If you bring a graduate of mass communication to come and anchor this program, he cannot do it the way somebody who has been here for 5, 6, 10 years will do it. So as long as you are in a practice for a longer period of time, the experience you have, they say experience, they know they buy them for market. The person will have that experience. And people we are touching, they will have the touch of that clinical expertise.
Okay, now back to you, Dr. Tokpe. Now, how does this extension align with global best practices in the health sector?
Yes, just like I mentioned the other time, what the global the standard globally is for you to have a specialized care And the essence is for us to retain these as specialists because they are few in number. Though it still doesn't, correct the anomaly that is happening within the health sector, but I feel that this is just a stopgap so that whatsoever the issues are, just like the comrade has said as well, you cannot compare those who have the experience over the years to somebody who is just leaving, the field of study. There are so many things that would have been gained over the years, and I think for Nigerians, this is a good one for us. It will help us so that we will retain the best hands, and by retaining these best hands, I believe that we'll be ensuring that we give the standard care that you can have worldwide to Nigerians.
Okay, we'll take a breather here. The program will continue after the break. Don't go away.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different?
We want to know what they do as occupation. All of these are attributes that are questions have been designed to investigate.
In a few days to come, you see that they are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. Welcome back. This is still Nigeria Today. We are looking at the extension, of course, the policy of extending the extension of working age of the health workers. And of course, I have two gentlemen, one via Zoom and one here in the studio. Now, Comrade David, you said so much about some of the benefits. Are there no challenges that can be encountered in this policy? Because here, the people that are supposed to be resting after 60 years, it's assumed that, okay, you're supposed to go and rest. And now here they are taking care of health-related issues. So would there not be implications?
There will be implications because, when you say even retirement at 60, there are some people, by the time they will get in at 60, they are even weak and weary. They cannot practice. But the coverage is that those who have the capacity, who have, nature has endowed them with the good health to do that, will be able to be retained to do this. It's not that there will be no challenges. And secondly, when you talk about building capacity, if these people are there, they can be able to put across, pass that knowledge to the incoming ones, so that there will be a transition that will help. But the challenge you may find in the process is that there will be some people who will want to stay because they are in the health industry. Because the operative word is clinical frontline health workers. So we need to be able to look at it holistically. Which target, which level of professionals are we targeting? So that we don't make it all commerce affair, because not everybody in the hospital is a health worker. So that we'll be able to differentiate it. But the benefits outweighs the challenges. Because let me give you an example. If you say somebody should retire and you retain him, maybe on contract for 2 years, the person is earning his pension, he's collecting another salary. Why not use that period, that money to use it as a service year? It is more beneficiary to government, more economical than allowing them retire and then bring them back on contract. It doesn't make economic sense. And secondly, the patients or clients in the hospitals there are some people that like a consultant, there are patients that immediately you tell him to go to another person, outside that is consultant. He will not. No matter the expertise of the person you are referring him or her to. So that in the process of this extension, people will be able to be transmitting this to them. At least in the few years I may be going, we have trained some people that will be able to continue where you see I'm already getting old. That is the process of transition from one generation to the other. I think generally that the benefit, if we apply it very well, outweighs the advantage we may get.
Thank you very much, Dr. Tokwe. Okay, Dr. Comrade David here, he mentioned some of the benefits, and of course, he pointed out some of the challenges. However, will this policy not affect, the job opportunities, employment opportunities for younger professionals, health professionals?
I didn't get that.
Okay, I'll take it again, Dr. Tokwe. I said, having had some of the benefits of this policy, will it not affect the employment opportunities for young professionals?
All right. Yeah, definitely. It's one of the drawbacks that will come with this kind of policy. So it will just mean that younger consultants or fresh consultants emerging into the society or into the workforce will not have the opportunity to work in their field because the older consultants are still occupying the space. And it will also mean that it will widen the financial bracket for government. So invariably, the funding for health, because part of the funding for health is giving incentive to the health workers. So this will create more burden on government because, of course, if you have a consultant who is of age, who has practiced for quite some time, what you are going to be paying that kind of person, either a consultant or any other health worker, in that, with the years of experience, what you are going to be paying them will be more compared to what you are going to be paying somebody who just graduated or who just left school. So invariably, apart from widening this financial bracket for government, it will also create some sort of unemployment for fresh graduates or fresh doctors or for other health workers seeking for employment in various hospitals that we have in Nigeria. But one of the ways to mitigate against this is to ensure that we have universal health coverage for all. And that would mean that we have more PHC. Some of our doctors, some of our elder health workers can go into rural settlement. If you provide adequate incentive, especially for these new doctors or new health workers in either nursing, pharmacy, what have you, if you create adequate incentive and enabling environment for them, it doesn't mean that whatsoever the policy the government is doing now will now affect the other one. So creating more opportunities, creating more healthcare, facilities, and equipping those facilities will also help, and it will go a long way so that one will not affect the other.
Okay, now back to you, Comrade David. Now you've, of course, you mentioned the JAPA syndrome, yes. The migration syndrome by the health professionals. You said the younger ones have been moving. Now, with this policy, with this extension, will it help reduce the brain drain, the movement of professionals, yes, from Nigeria out of the country to go seek maybe better opportunities or so?
Well, to a certain extent, it may, but I don't think it is the driving force. Because people who are already here up to this 60 have either one way or the other taken a decision to help ameliorate the suffering of the people. The younger ones have more interest. One is that you have many graduates in different fields who are not employed. If you go to our health facilities, they are hospitals. Like the doctor said, we have the patient-doctor ratio is not acceptable. The same thing goes to nurse-patient relation. And at the end of the day, you find out that government is not even employing. Let me give you an example. Last year, the National Military Council, through the instrumentality of government, went and placed for you before you come to travel. They said you stayed 5 years. You didn't give that person job here, and you want the person to stay 5 years. Is it workable? So the import of all this thing is that we need to begin to rethink how do we manage our systems, because yes, definitely those people above 60, who will be 60 to 65, will reduce the chances of the younger ones being employed. But if you look at the manpower needs of our facilities, we need to expand the employment in these core areas, professionals. 3 days, today is Friday. On Sunday, I was at University of Youth Teaching Hospital. I went to see somebody at the accident and emergency unit. The beds were full to capacity. There was no vacant beds in that place. Then how many nurses and consultants are there? About 4 patients were on oxygen. So there is a challenge we must all look at and find out. So it is a system that government and us as Nigerian citizens must work together to see that our system work.
Okay.
Because if it is not working, even if you return people, say 65, 70, those who have opportunity of traveling will still go out.
Thank you very much, Comrade David. Now, Dr. Tokwe, before we go, just talk to us. Comrade David, of course, he has mentioned this movement, this Japa syndrome in the health sector. We know there are issues, there are challenges in the health sector, and of course, this policy is one of the instruments that government is putting in place to ensure that we make the health sector better. Now, tell us, what more can the government do to give us a health sector of our dream?
Okay, there are so many things the government can actually do to give us the health sector of our dream. And I want to appreciate the effort of the Federal Ministry of Health and Social Welfare. They've been collaborating with, private sector to ensure that some of these concerns, especially for health workers, is being addressed. We've talked about this medical tourism. Unfortunately, even the Vice President even attests to this. And I was in Zenith Medical Center and Kidney. I think that hospital is in Abuja. Zenith Kidney Center and Medical Care also. That's the name of the hospital, and they've been doing quite a lot. They were in Sokoto, I think, last week, and they were able to, do all those things, kidney transplant, so many other things. There are so many cardiothoracic surgery that was carried out in this facility, and it is a way of improving the economic state of the country. So rather than traveling out of the country to go and pump money, you fly their airline, you get to them, you pay for their service.
Draw the curtain of today's episode of Nigeria Today. Very big thank you to Dr. Tokwe Zenith Oshundara. He's the President, Nigeria Association of Resident Doctors. Thank you so much for your time and your contribution, Dr. Tokwe. And also here in the studio, we had Comrade David Chukwuka Ezugu. He's a Deputy General Secretary and Head of Department, Research and Statistics, National Association of Nigerian Nurses and Midwives. Thank you so much for your time and your contribution.
It's my pleasure.
And thank you for being part of the program. I'm Eukaria Clinton. Have a wonderful weekend.